What physiological changes happen after a C-section, and how can you support optimal recovery? Guys, this is a voiceover because something happened to my audio when filming this video, but I still pass the same message across, so I hope this is useful. A C-section is major abdominal surgery with distinct healing phases. In the first 72 hours, your womb shrinks, causing cramping, which is also known as after pains. Inflammation from your cut or wound gets to a peak level, and in that time, opioid-free pain management tends to be quite critical. Next, let's talk about weeks 2 to week 6 after your C-section. The facial layer, which is the connective tissue underneath the skin, is important because healing is happening there at this stage. So we recommend avoid lifting anything more than 10 pounds. So of course, your baby lifting is fine. Adhesions begin to form without mobilization of the scar, and that can lead to thickening of the scar, which many women find happening commonly. And now let's look at 6 months plus after your C-section. There's something called nerve hypersensitivity that could develop. A significant number of women report chronic scar pain because of nerve sensitivity persisting all this while after the CS. But now let's talk a little more about your C-section scar. Many women notice hardening around their skull. This is often from facial adhesions where the internal tissues stick together as they heal. Having gentle massage after 6 weeks and once cleared by your doctor and pelvic physiotherapy can soften those areas around the scar and restore mobility of the skin and tissues around it. But why does this actually happen?
Hey there, I hope you're finding our videos helpful. I'm Dr. Sylvia, GP and Cannes Women's Health 2025 Award nominee. Are you having leaks, urgency or pelvic discomfort cramping your style? Please don't be embarrassed. It's not just about getting older. Let's talk pelvic health and fix it. I don't want you to suffer silently because I provide trusted, discreet care. So come on, book an appointment at yourgpconsultation.com. The links are in the description box or in my bio.
So first, let's look at normal healing after the C-section. The fascia, that's that connective tissue layer I talked about underneath the skin, thickens and shortens during your recovery, creating a firm ridge of skin that you would feel when you touch your C-section scar. But when adhesions happen, the scar tissue binds between the womb and the bladder or the abdominal wall, which causes tightness or pulling along the scar. Now, don't panic. This is a fairly common occurrence, and constant or consistent rehabilitation usually gets things back to normal. Something else that's useful is pelvic floor physiotherapy at your 6-week checkup, using circular massage with a carrier oil like coconut oil, which is only recommended after the incision is fully closed and you receive the full go-ahead from your doctor, or a women's health physiotherapist who specializes in C-section rehabilitation. These are useful measures to deal with thickened or troublesome C-section scars after recovery. Okay, so how else can you prioritize recovery after the CS? Well, first is movement. Walking within 6 hours after your surgery helps to prevent blood clots. That's really important. By 2 weeks after surgery, you can start to do pelvic tilts. Again, please get your doctor's okay. And there's deep core activation that you can do at 6 weeks after surgery. I know I sound like a broken record, but please get your doctor's okay before embarking on any form of exercise. There's also scar care. So let's talk about silicone gel sheets that can help to reduce keloids. Keloids are raised scars that can develop following minor wounds. However, they can grow quite large and look unpleasant. And so for people who may be prone to developing keloids, silicone gel sheets hydrate the scar tissue, change collagen production, and help to flatten the raised scars by constantly applying a light pressure while you have them on. You typically apply them only after the wound has completely closed, so that's about 6 to 8 weeks after surgery. Use for 12 hours or so a day, or not more than 12 hours or so a day for the first 2 to 6 months. Another option is myofascial release, which is something you can do from 8 weeks. That's another technique for dealing with CS scars. And that is performed by a trained physiotherapist. What they do is they gently stretch that fascia tissue to release the tight areas. In order to prevent adhesions from developing, some women wear abdominal binders and they leave this on for between 8 to 10 hours a day, and they help to reduce the strain on your cut during movement and prevent adhesion formation because they limit the separation between the tissues. You can apply them immediately after surgery or within 8 hours. You should limit their use to nothing more than 8 to 10 hours in a day because wearing them for an extended period of time may weaken the core muscles. You're also advised to avoid them during sleep. Manual therapy is something that some women can do from week 4 after the C-section. And techniques include something called scar mobilization, which is where gentle friction, cross-fiber friction is used to break superficial adhesions. Another thing that's done here is desensitization, rubbing fabrics like cotton or silk near or around the scar to normalize nerve sensitivity. And that can be helpful for women we talked about earlier with hypersensitivity. This should be started after 4 weeks only if there is no sign of wound infection or that the wound is breaking down. Avoid direct contact with the scar until cleared by a provider, and usually we recommend starting with a very light pressure initially. Early mobilization prevents something called the C-section shelf, reducing the scar adhering or sticking to the abdominal muscles. Studies do support this type of massage to help to improve the scar's pliability, softening, and to reduce pain after the C-section. Very important to remember, please seek urgent medical advice after your C-section if you have a temperature more than 38 degrees or develop a foul-smelling discharge from the wound or from the scar. If you experience severe pelvic pain, where we need to check that the womb has not ruptured, or there's heavy bleeding or persistent bleeding, you're experiencing soaking of more than 2 pads in an hour. Looking after your C-section wound is important for your next pregnancy, and so it's recommended that you wait about 18 months before the next pregnancy to prevent womb rupture. In particular, respect the 9-month recovery timeline. Use this period to prioritize your rehabilitation over quickly bouncing back and getting your pre-pregnancy figure back in a flash. Thank you so much for watching. Let me know what you guys think about this video. I hope it's been helpful, especially if you've just had a CS and wondering how to look after your C-section scar, or you've had issues with the scar already. Let me know in the comment section and I'll see you again in the next video.